Hello everyone, I am Dr. Bhargav on behalf of Neurology Department, Narayana Medical College. Today, as February 12th being the International Epilepsy Day, I want to share few points and few awareness points regarding this epilepsy. Because epilepsy is very common thing which is been seen around 12 million people in India and 70 million people in the world. So it is been emphasized to know each and every person in the society should know regarding this epilepsy. On these terms, Epilepsy Society this year has taken the theme as milestones on my journey in the epilepsy. So on this, they want to emphasize that each and every epileptic patient should be taking their responsibility in sharing their views regarding the epilepsy journey, how they have gone through, so that they could have very much confidence in them, and also as a part in the society, they will be able to emphasize these points so that they could spread some awareness in the society. So coming to that, what is this epilepsy? Why will we get epilepsy? So in this epilepsy, the patients will be having an excess electrical stimulation in the brain, so that causes the seizure activity. So when there is an excessive electrical activity in the brain at a specific point in the brain, that causes an focal epilepsy. When there is a generalized area in the brain developing these electrical activity, they will be presenting as a generalized tonic-clonic epilepsy. In these epilepsies, patient may be presenting with the awareness will be preserved, and certain times in focal epilepsy, the patient per se will be saying they are having the jerky movements of the hand or twitching movements onto the face or in the lower limbs. But in these generalized seizures, patient will be complaining. Patient attendants will mostly be saying that patient was not able to remember the event, but there was an generalized movement and tonic movements of both upper limbs and the lower limbs, with frothing from the mouth, tongue bite, and uprolling of eyelids and soiling of the clothes. And after a brief period of that seizure activity, there was an 10 to 15 minutes episode where the patient was not responding to our commands. This will be classical presentation of generalized tonic-clonic epilepsy. Even there are n number of different vivid presentations of seizures. Those need to be recognized by the patients. When these seizure activity is present, they should be taken care should be taken regarding these by the attendants, so that the patient during the time of seizures, there will be no issue of hitting themselves to the wall or hitting to the sharp objects. So when you find a patient with seizuring, there should not be any panic episodes in the patient attendants who are surrounding them. They should take care that they should prevent the head being hitting to the floor or removing all the sharp objects in beside them. Never the crowding should be done around the patients, so that there should be proper aeration. Patient should be left lateral position, they should be tilted so that the frothing and the tongue is not posteriorly fall. The frothing also is not been into the lungs and causing the respiratory depression. So taking care of these activities, they should be also emphasize that these metallic objects like putting the keys or pouring some water into the mouth, this old belief should also be taken off, because there is no scientific evidence proving that these are causing certain improvement in the seizures. When there is a seizure in the patient, they should be immediately brought to the doctor. Doctor per se, neurologist will see which type of seizures are there. If you could help the doctor by taking a video of the seizure activity, it would really help to the doctor to take the type of the seizure and choose which medications will be useful for the patient. Immediately after, doctor will be taking the MRI and even the EEG. These will show the type of the seizures, so that he could start on the medications. These medications will help them to treat the seizure activity. If this single medication is not helpful, they can even choose the 2 or 3 medications. Even after that, if there is an refractory epilepsy, doctor will advise you for certain advanced treatments like deep brain stimulation or magnetic brain stimulations or vagal nerve stimulations, or even after that, if there is any structural change, he may also advise for a surgical lobectomies or colostomies. So by taking these into consideration, there is a 100% treatment for these seizures. So there is no need to worry, but you need to promptly act and get a treatment properly. Even the patient should also take care that they are having a proper 6 to 8 hours of sleep. They should avoid any alcohol consumption, taking the drugs as per the time. So by these, they could prevent the further seizuring in the patient. So there are certain small doubts in the seizure episodes in the patients. They may ask, can the seizure patients can lead a 100% normal life? Yes, doctor will always suggest that they are treatable disease and every patient can live for a 100% normal life. But certain precautions should be taken regarding their occupation, like high risk occupation status like driving, swimming, or working in the hot places or high altitude regions. They should prevent these occupations so that they are not at risk when there is any seizure activity during that point. So by doing this, can they lead a normal life? Can they marry? Can they have pregnancy, or can they have a children? Yes, 100% they can have a normal marital life. They can go with their children, or even in the pregnant female, if they are having any seizures, they need to be meeting the neurologist so that these anti-epileptic drugs which are safe in pregnancy can be placed. Even if they are on the drugs and they are having an accidental pregnancy, this drug dose modification should be done, because they are metabolically, hormonally they are having high metabolic state, so those adjustments should be done. So by these taking into precautions, they can lead a 100% normal life, and the seizures are 100% treatable. Thank you.